Finally, the wait is over, sir, and people, I think, are very much excited to hear you out. So, Dr. Satish Kumar has done his MDS in periodontics and implant dentistry. He currently runs a four-step dental practice and consults across various clinics in Navi Mumbai and Thane. Being the first dentist in his extended family, he had no idea how to go about starting with his career in clinical dentistry. With time, he understood the best practices for not just surviving but thriving in dentistry. He had the desire to share this knowledge. This led to the inception of Kaizen Dental. The vision of Kaizen Dental is to help every young dentist know their dreams and help them achieve it. Kaizen Dental also runs a YouTube channel where they post content on various options after BDS. You can find content related to going abroad, to non-clinical options after BDS, and even starting a clinical career in India. So with this, I would welcome Dr. Satish, sir, to take over the platform. The platform is all yours, sir, and we're eager to hear you out.
Hello, am I audible now?
Yes, sir.
Let me just screen share 1 second. Could you see the screen?
Yes, sir.
So it was a really good session to see youngsters doing just a minute. Okay. And again, I'm telling you, the topics were really nice. So coming back to my lecture, we'll be talking about how to start a career in dentistry once you finish your graduation. So this topic is basically meant for freshly or young graduates basically. I hope you can see the video. Hello, am I audible?
Yes, sir.
Yes, sir, you're audible, sir.
Yeah. So starting with a presentation, if you see, whenever you graduate, you're always confused. Your confusion is compounded by the number of options which are available. If you see from a third person's perspective, they think it's very simple. You have to decide between two roads, maybe clinical or non-clinical, India or abroad. The problem is the options after dentistry is not like that. The options of dentistry is completely like a crossroad. If you take one route, you might end up somewhere else. This is something similar to your Bombay roads. If you take a one wrong flyover, you'll end up in a totally different place from where you wanted to be. So starting out right is extremely important to reach your destination. So before you know what your destination is, you need to understand what success means to you. Randomly going out asking for advice does not help because you really haven't defined what your own success is. So before I begin giving you advice, I would like to tell you something about my journey and what got me to this position where I think I should help others out. I done my entire schooling. That's from my kindergarten to my 12th in Dubai. Uh, and at that point of time, this movie was there, Swades. I was a big Shah Rukh fan. I don't know if anyone of you is. And there was this feeling to come back and give something back to your country. So that led to me coming back and doing my graduation in India. Once I started with my graduation, I was completely focused on passing 1 year after the other. If you ask anyone who's in BDS, the majority of us are only focused on agla kaunsa assignment hai, which next work we have to finish, whether you have an internal exam or you have an external exam, and you just focus towards it. Suddenly, you look back, 5 years of your BDS is completely over, and you're confused. Abhi kya karu? You just ended up and you really don't know where you are. It seems as if you're back at the starting line again. So what do? You then ask seniors or you ask mentors, hey, what should I do? And when I asked them, I got different responses. Some told, if you do not do MDS, there's no value for your BDS degree. Others told me, ask money from your dad and put an amazing dental clinic, and the patients will begin to roll in. And then there was a third lot who told, India mein scope nahi hai, there's no scope for dentistry, just leave this place. So I was confused. What I decided is, I will first understand whether I like dentistry or not. So I joined a clinic. Soon as I joined a clinic, I was lucky to get amazing mentors. As I was practicing, I realized that I don't like to do everything in dentistry. I would like to do a specific field. So then I made up my mind I need to go and do MDS. I joined an MDS college, and again, I was lucky enough to meet amazing mentors. Simultaneously, I put a clinic, and my clinic started picking up. So by the time I finished my post graduation, I had a practice which would give me basic bread and butter. And I realized that I want to do perio for life. So I'm a periodontist per se, a field where majority of the people who get into is कि दूसरा कुछ नहीं मिला, so let me do clinical perio. But it was personally my first choice based on the type of patients I had seen prior to it. Once I got into perio, I started lecturing. Then one fine day, there was this conference where I was sitting with a lot of senior dentists and we were having a chat. So out of them, one was who has regular lectures all across India from north to south. He's an international speaker. I was always in awe of him. Wow, that is a kind of speaker if I want to be something I should be. Then there was a second dentist, an amazing practitioner with two clinics of 6-chair practices each. He was another one who I looked up to. Then there was a third senior. He had just joined a college, maybe for 2 to 3 years. He had a small practice of his own. So as we were chit-chatting after the conference, you know what happens at the end of conference? People start chit-chatting, they have a lot of liquid diet, and as that goes in, slowly the mask started coming off. And these mentors opened up about their lives. The first one, who was a huge speaker, is currently also, told me that, Satish, I do not enjoy traveling every time. It started as fun, but now I'm bored. I'm doing it because if I sit in my clinic, I would not be able to generate the income I make by speaking all across. So for me, it is one good source of income. Given a choice, I would like to cut down on my work, on my speaking, and become a practitioner. I was surprised. I had never seen this side of him. Simultaneously, the second person with two 6-chair clinics told me, I am strained. I'm usually stopping fires in the clinic. Basically, somewhere some patient had a problem, somewhere some doctor had a problem. I am solving human resources or HR problems. I would prefer running a practice where I have a single chair and I'm doing amazing work. And surprisingly, the most satisfied of the lot was the person who was working as a staff member and had his clinic in the evenings. So my concept about what success is took a sudden hit. I was not sure कि success hota kya hai. I want you all who are listening to this lecture to define what success is. I'll give you an example. There are 3 practitioners. First one with a single chair practice. Second has a 3-chair practice, and the third 10-chair practice. The 10-chair practice has 12 associates, 3-chair practice has 3 associates, 8 staff, 1-chair practice, no associates, single dentist himself with a few staff to help him. The first chair, 1-chair practice has only 8 to 10 patients a day. When you have 3 chairs, they see around 15 to 22 patients a day. And the third, around 80 patients a day. What would you consider as success? I want you to put it down on the chat box. And I want you to put it on the comment section if you're not in a live feed right now. I'm sure the majority of us, from a third person's perspective, would say clinic number 3. But let's go in a little more deep. If you have a single chair practice, since your outgoing is less, even if you do less patients, you have a greater chance on profit. So the 1-chair practice has a 3 lakh profit, the 3-chair practice has a 4 lakh profit, and a 10-chair practice has 7 lakh profit per month. Now, you have maximum stress when you have more staff. So clinic number 2 and clinic number 3 have a lot of stress inbuilt to it, whereas clinic number 1 has no much stress. The doctor who is either having a 1-chair or a 3-chair practice would get free time to roam around. Someone with 10 chairs might have a lot of stress, no time for vacation whatsoever. So again, whom do you think is happy? 1-chair, 3-chair, or 10-chair? Now, the twist in the tail. Since they are getting regular vacations or no vacations, what do you think their families would feel about it? Imagine clinic number 1 and 2, the spouses and families are absolutely happy because the dentists are able to take time for them. And the spouse of the third clinic, she herself is also happy. Maybe there are a few type of people who do not want a lot of educations. So imagine in all these 3 cases, the spouses are happy. Now you get to meet these dentists one-on-one. The person with a single chair practice, if he feels that he's not happy where he is, he wanted to expand, but he couldn't hire associates, he didn't know how to grow. Maybe he feels he is professionally unsuccessful. Maybe the person who has a 10-chair practice is feeling that when he gives everyone else work, he is not able to do the artistic dentistry he wants. He's busy just managing patients throughout the day. So what would happen in such a case? Whether it is either a 1-chair or a 10-chair, you might be unsuccessful. It depends on what you feel internally. So what were the factors in these clinics which defined what success was? Was it this first chart? Whether there was 1 chair, whether it was 3 chairs, how many patients? No, of course not. Was it how much money they made? Again, no. If you see, all the responses of success is basically whether you personally are happy as a professional and whether the entire surrounding around you, that includes your family, your team who is working in your dental clinic, are happy with the type of lifestyle you're leading. You would say this is related to clinical dentistry. I am planning to do non-clinical dentistry, so this is not relevant to me. Imagine you have 3 females in this case. Remember the Nirma ad? Rekha, Jaya, Shushma? I am giving you these charts. By looking at them, could you decide whether who is happy or not? It really does not matter whether you are an associate dentist, you have your own practice, whether you're an MDS, you're not doing consultation, or you're doing non-clinical work and just 9 to 5 job, and you're not the boss, you're answering to a boss. It depends what you want for life. So what is the definition of success in these terms? Success is basically achieving the results you wanted. This is the Cambridge definition. You go to Oxford definition, you get again the same thing, achieve something that you want. The problem is, since I started Kaizen Dental, I get at least a message once a week or once in 10 days stating, sir, please tell me the best way to get successful after BDS. Which is the field after BDS, if I do, I'll make the maximum amount of money. I would give you examples. There is Mark Zuckerberg. There is Elon Musk. There is Bill Gates. There is Warren Buffett. These are all first generation billionaires. And each one has made money in a different field. Do you have another Facebook? No. Do you have another one person who's similar to Warren Buffett? No. Do you have someone who has multiple businesses like Elon Musk? No. So success is depending upon what you want for life. If you ask me, I would always tell you what success is should come from within. You are an individual. So deciding what success is on my basis would not help you out. So imagine me answering to these questions on Kaizen Dental, like you should do MDS and you should make a lot of money. But I'm putting you in a different track. You, on the other hand, someone who does not like doing a specialized work. You would like interacting with a lot of people and you want to get into a corporate setup. So listening to my advice blindly will just not help. So whether you want to do this or you want to go up on which ladder you want to climb is something you need to decide. You don't want to look back after 10 years or 15 years. I'm on the peak of what I'm doing, but I'm at the wrong ladder. It's like you wanted to climb Himalaya mountains and you ended up in Alps. So you have to decide which is your mountain you want to climb. So in today's lecture, I'm just going to give you 3 steps. The first 3 steps which will take you on a path of success. Step number 1 to how do you start your own success story is know yourself. Aristotle has always told it long back. Knowing yourself is the beginning of all wisdom. You might know all the things around you. You might know dentistry as a whole. You might know all the options available. But did you spend time knowing yourself? What success means to you? That is something you need to look forward to. When you want to meet someone, what do you tell them? Why don't we hang out for coffee? I want to ask you, when was the last time you hanged out with yourself to understand your desires? Imagine you're a consultant. I tell you, you have to let this person reach his goal. What you will tell? कि पहले goal क्या है? Tell me what your goal is. Similarly, if you do not know what your goal is, how will you make yourself successful? So knowing yourself is extremely important. How do you do this? The first and most common method, which is even used in corporates, is something known as SWOT analysis, in which you see your strengths, weaknesses, opportunities, and threats. I would tell you, as a human being, just start with your strengths and weaknesses. Strengths means what? What are you confident about? Are you confident to speaking with patients? Are you confident in corporate settings? What do you feel you would be good at the end of the day? Know what you're good at, what you're weak. Try improving the stuff which you think you're weak at, but are very important in life. Maybe communication skills. These are skills you need in both dentistry and if you're doing non-clinical. So understanding your strengths and your weaknesses forms the first basis of knowing yourself. If you're not good at asking yourself, the option is to ask your friends and family, what do they think? Because they would realize when their situations were tough or the situations were easy, how did you react? For example, a patient came into your college for getting a class 2 filling, or you guys wanted a class 2 filling for your exam, and you were the one who was confident enough to sit and convince the patient to please get the treatment done. Or are you that type who is not good at convincing patients, but when you put your hand into the patient's mouth, there is magic which happens. Your fillings are perfect. That's your restorations. Your crown cuttings are perfect. Your root canals are perfect. So do you suit clinical dentistry or not? You can think yourself or you can ask your friends and family. The other option is to look back at various instances. How did you react? When there was a teamwork which was required, were you good at forming the team, delegating work, getting work done? So how you find out about yourself does not matter, but knowing yourself is the final position where you need to reach to. Now if I ask you, what do you like? I'm sure a few of you will tell me कि I like my life simple. मुझे सिर्फ खाना है और पीना है. Yes, there is a job like that. If you check something like WakeFit, every year they hire one person, they give them 10 lakhs just to sleep. But sadly, these jobs are very few. So if you're lucky and you get that job, good for you. But for the majority of us, we have to do something for the society. So the society pays us back. So just not knowing what you're good at, what you can do for the society also plays a very important role. So success is where you know your strengths, what you think you will be good at, and what people want. If you can find a match between these three, that is where the magic happens. That is where you'll find the most successful people are. The rest would either only do what people want or what they care of, but they are not their strength. So they always find it difficult to grow. There are some people who work on their strength and what they want, but people don't want it. So you will not grow. People will not pay you for it. So finding that sweet spot is something which you should look for. Once you know your strengths, then what's the next thing? You need to move to step number 2. Know your options. Lucky for you guys, we at Kaizen Dental are doing that hard work for you. When I had graduated 10 to 15 years ago, I had no such resources to tell us what options are there abroad, what options are there in dentistry, what options are there in non-clinical as such. So you have the entire internet in front of your fingers. Not just Kaizen Dental, you can use Google and you can find out all the reasons out there. At Kaizen Dental, we have everything. If you plan to do dentistry in India, how to search a job, how to do MSc fellowships, whether you should get into aesthetic dentistry, whether you should get into implant dentistry, what is facial cosmetology, everything related to dentistry in India. We have similarly in non-clinical options, whether it's MHA, MPH, pharmacovigilance, clinical research, or forensic dentistry. You don't want to do non-clinical, you don't want to do clinical, you decide just you want to go abroad. Then we have had an entire series of videos of how to build your career abroad. So your options are ready, your interests you know. Then comes the step number 3. That is, how do you sort your options? Now, the most common problem with sorting options is when we graduate, okay, first we see a senior staff member and we say, Sir's life is the best. You come to college, you yell around people, you manage your stuff, and you go home and you get a paycheck at the end of the day. So I'll do MDS. Next day, you go and see a clinic. The doctor is working continuously. Patients are paying one after the other at the reception area, and he's making a lot of money. Then you think, I should put a clinic. There's more money in clinic than in MDS because I can do what I want when I want. Then you think, oh, my friend that day told me that he's trying to go abroad. Why is abroad not a good option? I should try that. Then the 4th day, you end up thinking, I don't think I should do dentistry. Everyone is telling dentistry has no scope. Let me do something like MPH or MHA. Then 6th day, you're thinking, I saw that post on Facebook. That lady has done amazing implant dentistry work. I should also place implants. I've heard implants mein to bahut paisa hai. Then you see a course advertisement for forensic dentistry. This is something unique. I think forensic dentistry has scope. The problem is all these options are random. Then what happens is when you have this entire list, what you do, you're skipping from maybe 1 to 15. So morning you're thinking MDS, evening you're thinking insurance. Next day morning you're thinking UPSC, evening you're thinking whether I should get into army dental. So this confusion between everything is which draws you further down. My suggestion is to use something known as a decision matrix, okay, where you decide only one after the other question. Now, the entire options which we posted here is similarly out here. But the difference here is I have only taken one problem at a time. First, I'm deciding whether I want to settle in India or I want to go abroad. I am not debating at that point of time whether MHA, MPH, nothing. Whether I want to be with my family or whether I want to have a better standard of living. Do I want to move abroad? So at that point of time, it is easier to debate and discuss and delete one option. So imagine you have decided, no, I want to be with my family. I love my country. I don't want to go outside. So all your abroad options go off. You do not have to complicate yourself by looking at videos, reading about articles, of going to various countries. Now, if you're having a problem of deciding whether you want to do it India or abroad, the other option is you can start with whether you want to do clinical dentistry or non-clinical dentistry. So whenever people ping me in Kaizen Dental on Instagram and they ask me these questions, whether I should do clinical or whether I should do non-clinical, I have seen people asking random questions. For example, should I do MBS or should I do MHA? MDS and MHA are totally opposite directions from each other. We have a joke in Mumbai. It's called Karjat Kasara. As in they are at two different ends of the world. So you have to decide whether you like working on patients. If your aim is to work on patients and treat them, then you should not think about non-clinical options. If your aim is that I do not like putting my hand into patient's mouth, I did dentistry maybe because I didn't get MBBS at that point of time or because I was naive at that point of time, but I do not like treating patients. I want to get into management or I want to do something else. So at that point of time, your clinical options are off or your non-clinical options are off. So discuss and with your friends and family and check one point after the other rather than randomly looking at options. So getting a decision matrix, okay, is extremely important. So this is the third step which you need to go in. That is sorting your options one after the other. If you have decided you don't want to do non-clinical, the entire space is off. You have to only focus on the clinical options. Now, the problem with majority of us when we graduate is when we look at the topmost people, we end up thinking that they plan their entire career, as in when they just quit dentistry or sorry, they graduated from dentistry, they already knew what they want to do after 10 years or 15 years. But that is not the case. If you see the topmost cosmetologist, Dr. Sandesh Maekar, he did his B.DS, he did his M.DS in a non-clinical field. As he was doing it, it was then when he realized that he likes aesthetic dentistry. He has an amazing book, you should read that. At that point of time, he decided to move towards aesthetic dentistry. Yes, he spent 3 years doing MDS on a non-clinical field, but no one knows the answers at day one. You can look at any successful career. There'll be a lot of mistakes and failures. So having this mentality that at day one, soon as I graduate, I should know everything I do for the next 20 years is not the right approach. I would like to share with you a small video from I'll just see from Oprah. She speaks really well. I hope the volume is also connected. Just put it on.
And if I always ask people on Super Soul Sunday to tell me, what would you say to your younger self? Every person says in one form or another, I would just say, relax. Relax. It's going to be okay. It really is going to be okay. The way through the challenge is to get still and ask yourself, what is the next right move? Not think about, oh, I got all of this to do. What is the next right move? And then from that space, make the next right move and the next right move. And not to be overwhelmed by it because you know your life is bigger than that one moment. You know you're not defined by what somebody says is a failure for you, because failure is just there to point you in a different direction.
So my biggest takeaway from this lecture for y'all is relax. Everyone has gone through what you've gone. You're not the first dentist out there who's had this problem. And you're not going to be the last one out there. Only important thing is, as you're going to the next stage, do not go blindly. Do not just go with the flow. You do not want to be one of those who end up thinking, where am I? I should have thought this before. Only focus what you want next. Focus on that. And with that, you will achieve tremendous success. So the take-home points from today's webinar is, first is, you need to know yourself. What are your strengths? What are your weaknesses? What you enjoy, what you like, what you dislike. One option, one method of deleting a lot of options is always remove the things which you will never do. I knew I never wanted to go abroad at that point of time. So all that options just got wiped off. So knowing what you do not want to do also helps you come to a conclusion towards what you might end up enjoying eventually. So first point, know yourself. Second point, know your options. For that, follow Kaizen Dental. Third, sort your options one pair at a time. Do not go randomly, first point or third point and fifth point. Decide one step, whether you want to be in clinical, you want to be non-clinical. Select one thing at a time. And the fourth thing is, don't stress over it. You will be successful. It's only a matter of time. There's a huge life ahead of you. So worrying about it right now is not going to dent, it's not going to help you in any which way. It's just going to dent your mental peace right now. So these are the 4 take-home points from today's lecture. I hope you guys enjoyed it. Let me just minimize. Is everyone there? 1 second.
Yeah, sir, we are here.
Yes, sir.
I hope no one slept.
No, sir.
No, sir.
Totally.
We were listening to it, sir.
Okay, sir. It was an insightful presentation. It was very well explained, and it was surely an eye opener for everyone out there. Your words have definitely left an impact on the young dental minds. What better than this would have solved their confusion, which everyone goes through at this point of time, to actually decide how to go with which option. The SWOT analysis, which we explained, that is looking up to your strength and like improving your strength and minimizing your weaknesses. So in turn, you're strengthening yourself in all the ways. So when someone works hard on himself for achieving something, I don't think so there is a doubt that he can achieve heights in a greater amount, sir. Yeah. So I would hand the mic to Dr. Saloni to continue with the event.
So I utterly agree with you, Drumil. Sir, your words have definitely carved a way out for many struggling to make the decision. Also, in the participants here, if anybody has any question to ask to sir, because you get this chance first as you are on the platform here with us.
Sir, like what presentation you have shared? Can we do you have like I know you have made I've seen the channel right now. So like ये सारा presentation can I get in one like in one video?
I am going to come up with a book.
Oh,
okay,
great,
this
great.
is the first platform. I just spoken to Drumil the other day. I'm announcing it. Actually, I'm not told to even in the Kaizen platform as of now. So we are planning to come up with a book. So because what has happened is we have discussed about all options in our channel, but there's a lot of confusion about how to go about sorting these options. So the book would be in another 20 days maybe out. We're in the editing phase. Okay. So anyone who's watching this video, you can move on to our Kaizen Instagram page and just ping me that whenever we launch the book, I will send it across to you. So in that, we'll be explaining not just this, we'll be explaining a lot of things. So we'll be having topics like whether you should join a corporate clinic or not, how to select an MDS college, few things which you need to keep in mind when you're going abroad. So a lot of things about how to start a clinical practice in India will be discussed in that.
Perfect. Like I feel so unlucky right now because like the students who are in like budding stage are getting so good. Like they have to they are getting this, like a book is a thing that you can just follow and you can get to wherever you want. So all the best for the book, and मैं भी पढ़ूंगा sir. I'll be looking forward to the book as well.
Sure.
Sir, can I ask one question?
100%.
Sir, nowadays this is the biggest question here. MDS. When we should, as I am a second year student, so when we should start preparing for it, and how to aim for MDS? So how should we aim for it?
See here, MDS questions for your next, now it's NEET exam, it will be next in another 2-3 years, are basically B.DS questions. So the problem is, people think that I have to study something separate for the MDS exam. It's not like that. You have to start studying perfectly from your first year. Now, if you had a question about whether you should study from Indian author books or international author books, my opinion is, if you're studying from the perspective of passing the exam, that's like 1 month before the exam, the Indian authors are amazing. But if you want to crack the NEET exam, you have to study from the perspective of understanding how to go about it. So whether it's NEET or next, you have to know the basics right. Okay. So start studying from the first year. One tip is when you finish one subject, say you finish physio, you go to your library, don't even buy the NEET MDS book, rent it out from your library and just go through those questions once. So what happens is, as you finish every subject, I think I'm echoing.
Uh,
As you finish every subject, one revision of all those MCQs will be done. Your final studying for your NEET exam should be done once you're in internship. So the advantage, if you have seen from first year all the MCQ books, you're already done it once. A lot of people do not do that. So by the time you do your physio in first year and you come in internship, आधा physio have में. So revising it at that point of time helps it more. So as you're in second year now, you can just go through the first year MCQ questions if you're sitting free.
Thank, thank you so much, sir.
Welcome.
So if I may, I would
Sure.
like to go a bit personal. As you said, your schooling was done in Dubai from kindergarten to 12th. So uh, all these years I've been hearing about people going to foreign, many countries, Canada, America, and majority also CAs and dentists going to Dubai. So why not Dubai after completing your dentistry here? Like
Uh,
we heard that people earn a lot going after going to Dubai. So if I may know your personal take on it, why not Dubai?
I have a friend who was with me in school who's done B.DS and is in Abu Dhabi right now. That's a sister emirate of Dubai. The point is, it's a personal choice. That's what I've been discussing till now.
Yes.
Uh, I decided I want to serve my country. I'm not saying it's the right approach. Some want a better way of life, a better standard of life. It depends on what you want as an individual. When I got married 6 years ago, I and my wife we went and met a few foreign consulars also. But then we decided that we want to stay close to our parents. My dad had just retired during my MBS and come back, and we didn't want to go abroad. So it is a personal choice, which I think each one should make. It's not that there's no scope in India or there's a lot of scope there. Every place has its struggles. For example, if you go to the Middle East, you don't have a citizenship. 20 years, 30 years down the line, if they tell you, okay, bye, Tata, where are you going to go? You have to come back and start from scratch in India. So
True.
I'm not saying that will happen. There are a lot of people who were dentists when I was a kid out there. So they will complete their entire generation, earn a lot of money, come back here. But it's a personal choice. That's what I'm trying to tell people. Do not decide based on what I say. Decide on what is right for you.
I completely agreed. Thank you, sir.
Welcome.
Sir, we have some more questions for you. Sir, this is the question that, sir, before giving an INBD exam, which course can I do, MPH or MHA, or any other course, because I can't do clinical dentistry directly? Can I?
Where is in Canada?
Yes, sir.
Why
No,
do a
sir.
course?
Yes, sir.
Is it Canada or US? What is asked?
Sir, it's not
What's the question?
specified there.
INBD or NBED?
INBD.
Okay, so that's US. See, when you're going to US, this whole concept of I need to go there and study is absolutely waste of time. Even with ORE, a lot of questions I get is people tell me, I want to go there, work, and then give the exams. There is no need to do that. If you have a lot of money and you really want to spend it on MPH and MHA, yes, go ahead and do it. But if you have a GPA of already more than 4 point, around 3, 3.5 or 4, then adding MPH or MHA is not of a lot of use. So you can sit in India and completely concentrate and study to give the INBD exams. When you're doing MPH or MHA and you're studying for exams, you're already juggling between 2 or 3 things. So getting a good score in INBD becomes difficult. But yes, if you have a very low GPA, then going and doing a post graduation there like MPH or MHA helps. Now, MPH or MHA should be decided based on your choice. Whether you like hospital administration and MPH jobs are mainly on the epidemiology side. Whether you like that.
So we have one more question. Sir, I'm a third year student, and due to this pandemic, I was unable to learn clinical work. Now I'm third year and also getting wasted. So the third year is also getting wasted. What can be done in this situation?
I've made a complete video on that. Interns and fourth yearites coping with the pandemic. Look at that also. And the main thing is there are two aspects to dentistry. One is theory and one is clinical. For theory, it's the best time you're sitting at home. So the people who are self-motivated in the next 4-5 years, you will see in the pandemic situation, people who are self-motivated will be miles ahead of people who need to be pushed, because the pushing action from colleges are not there. Okay. So you'll see a lot of people like Drumil and Saloni. They've used this pandemic times to come up with an amazing YouTube channel. Okay. You'll see a lot of youngsters who will be learning a lot of things sitting at home. Then you'll have the others who will be spending their time on Netflix and everything. I'm not saying you should not have Netflix. You should not have fun. I watch a movie at least every 2 days. But not focusing on your career is a point which you should not go into. So the theory part is something which you can study at home. For clinical, there are various aspects. One is you can watch a lot of YouTube videos. Second, there are a Facebook where there are a lot of webinars conducted on clinical happenings. Read that. There are clinical procedures which, for example, you're studying about composites. See a composites video about how composites are done, what the procedure is, what the material is. So these things can be done sitting at home. So hoping that things will change, then I will learn is not going to happen. If you want to win and be successful, you have to put in the effort. And please go on to Kaizen Dental and look at that video. I've explained in that 4 different methods in which you can learn clinical skills.
So the last question of the day. So what are your views on not doing ASP DDS and doing AEGD in USA?
Sorry, I didn't get the question.
So what are your views on not doing ASP DDS and doing AEGD in USA?
I've not even made this video yet, but AEGDE is basically a type of specialization there. So you do 2 years on a specialized platform, and then you can practice in 10 to 12 states of the US out of the 50. On the other hand, if you do ASP and you do DDS, then you can, once you get your license, you can practice in rest all the 50 states. So if you have a specific choice, there are certain people who have certain relatives there. For example, if you're getting married there, your husband is in a particular state. So then doing DDS enables you to go and work in that state or any state of your choice. For that, you will have to do, after who was asking the question, after your INBD, you will be having the ADEA capate process. On the other hand, if you're going in for the MS process, the AEGD process, there are other specializations you can do. You can even go for perio specialization and everything. In those cases, you have to go to the pass process. So the process is the same. So I would always suggest doing your INBD, doing your TOEFL, and when you're applying, don't say I will only do AEGD, because what if you do not get it? Apply from the pass portal also, apply from the capit portal also. Let's apply for DDS also, apply for specialization also, and pick up what you get. Once you do AEGD, once you work in those 10 states for 5 years, you can practice for 5 years. Then in 48 or 49 states, you can practice after 5 years general dentistry. So that is the advantage. The only thing is that delay of 5 years. So my advice will be, do not close yourself ki I'll only do this or I'll do this. Keep your options open and try both.
Thank you, sir. Thank you, sir. I think most of the questions have been answered by all the things you have answered, and the seminar, definitely, the webinar has answered many questions. So thank you for the wonderful webinar, sir. And I would like now Drumil to take over.
You're not
Drumil,
audible.
unmute.
So it was a wonderful evening spent with you, sir, and thank you so
Same here.
much for taking your providing your valuable time and showering knowledge on this aspect of dentistry. So there would have not been a much better start than this, I would say, sir, because starting we are doing this for the very first time YouTube live webinar or any such kind of event on YouTube platform, and even I guess you have also debuted for the first time.
Yeah, it's YouTube Live. I've
So
tried for the first time.
yeah,
Thanks to
so
you.
yeah, so no better start would be in this state, sir. So we wish you all the success and love ahead, and we hope that we get numerous such opportunities in coming future to associate with you for
Same here.
further ventures in other aspects of dentistry, sir. On behalf of Dentistry to the Point, we would like to share a small token of respect and memory to cherish. Please kindly accept our token of respect, sir. I'll share the screen just a second.
Yeah. Thanks for it.
Thank you so much, sir. Thank you so much for
Thank
being
you.
with us.